Okay, we're doing this book right here, I Will Give You Back Your Health. It's by Dr. Lorraine Day. She kind of became famous because she was diagnosed with metastatic breast cancer in her mid 40s. They told her to make a will, she's going to die. And, she became a low-fat vegan and she cured herself. And she lived until she was 87 years old about. She died in 2023. And this lady was a real genius. Like all geniuses, she's a little bit crazy, but man, was she smart. You'll see it in this book. I'm going to go through her books. This is part one. It's going to do a bunch of parts here. Okay, this is kind of like Female Genius Week. I just did quotes of Ayn Rand. Now I'm doing Dr. Day's book. Okay, so here's the first one. She says, I will give you back your health again. That's a quote from Jeremiah chapter 30, verse 17. Now, here's Lorraine Day. The only treatments doctors are taught to give are drugs to make you feel better while your disease continues to progress, and they cut out your organs or they cut off your body parts. But neither of these things cures any disease. We abuse our body in many ways that we don't realize year after year until finally we have destroyed our immune system so completely that it can no longer prevent disease. Okay, and that's my experience too. The vast majority of people, 99% of them, they do things that are really bad for their health and they don't even realize it, They think eating chicken and fish and olive oil is good for their health, okay? That's a typical stupid person I talk to. Or they think wine is good for them. No. And they don't have any curiosity to learn. Okay. Anyways, let us continue. She said, doctors' diagnoses rarely give you any information about your condition that you don't already know. Why? Because they just give you a Latin name for the symptoms that you describe. You tell your doctor that you have chest pain, and he says you have angina pectoris, which means chest pain in Latin. She says the real question is, why did this happen? Instead of instructing you in the ways necessary to prevent a heart attack, your doctor will give you drugs or recommend surgery. But your heart attack was not caused by a deficiency of drugs and surgery. And if you don't address the real causes, then the chances of having another one for your heart attack, then the chances of having another one are very good. And it's the same for every other disease. Yeah, and so she's right on the money there. So the public tends to think doctors are so smart and that they're really well educated. I can tell you the average doctor has an IQ about 120, which is reasonably intelligent, but they have a very conformist mentality because that's what you're rewarded for. That's what you're selected for, to be a conformist, do as you're told, go by the standard protocol, don't ask any questions, don't make any noise. And there's always a bean counter in every clinic, every hospital in the Western world, cracking the whip saying, go faster, go faster, go faster, to get more billing codes out of the doctors. And then they always compare the doctors to each other and say, well, Joe Blow over there, is getting 30 billing codes a day. How come you're only getting 20? And you're like, well, because I'm trying to explain to the patient the vegan diet. And well, they go, we're not getting paid for that. You're not pulling your weight. You're going to have to get busier or we're going to have to let you go. So they have to conform to the system. Otherwise, they get fired and they're put at med mal peril risk. So you can't win going against the system unless you're going to go home late every day and you won't get any money for it. Okay, let's see what she says next here. She says, now listen to this. Oh, and by the way, so doctors learn a bunch of stuff that's nonsense, Pre-med education is a complete joke. It's a complete joke. Calculus is worthless. The carryover from calculus and physics to clinical medicine, 0%. There's none. Organic chemistry, what you learn is mostly how to synthesize paint. It's freaking useless the way they teach it, okay? Even the way they teach biology, most of it's this evolutionary biology nonsense. I don't even think it's true. I remember in college I was counting the number of mitochondria in a bug's ass. It was like a waste of time, okay? But there's tons of useful stuff. I can tell you this. I sometimes have medical students tag along with me, and I routinely do it all the time. I can do it like that. I can teach them more in 2 hours than they've learned in the last 8 years, easily, in terms of things that are relevant to taking care of a patient. Okay, anyways, here we go. Listen to this. Walk for the cure for breast cancer, for Alzheimer's, for multiple sclerosis. What is missing from these statements? There is never any mention of finding the causes of these diseases. In order to find a real cure, one must first learn the real cause of the disease. The cure becomes obvious when one knows what the cause is. Donating money to find a cure is a euphemism for donating money to develop another drug. But drugs never cure any disease. They only treat the symptoms of the disease. And she's got a good point there. Like a typical thing is, women have one of their friends sick from breast cancer, dying from breast cancer, and so they get a pink ribbon, and they want to, raising money for breast cancer. But, you notice the breast cancer company never tells them about the risk factors for breast cancer. It never tells them your risk factors, abortion, AB, then ORTION. If you do that to your baby, your risk factor goes up. They never tell them about it goes up with birth control pills. They never tell them it goes up if you don't eat a high fiber diet. They never tell them it goes up from all these exogenous estrogens, from your deodorant, from all these personal care products you use, okay, for example, from eating, KFO meat, okay. They never tell them any of these things, okay. So they don't empower them. They just say, give us your money. And, they do it. The women mean well, but they don't understand what they're doing. It doesn't make much difference. Okay, Dr. Day continues. She says, virtually all medical textbooks have eliminated the chapter subheading etiology because doctors don't know the causes of diseases, and that is true. Looking back, it's amazing that you almost never learn the cause of anything in medical school. They make you memorize the 20th symptom of some rare disease, but they don't teach you the cause of anything. The game is rigged. It totally is. It's designed to make sure they never know how to treat anything, just give a drug or recommend a surgery. Amazingly, the medical literature documents extremely well the causes for virtually all diseases. Yet all of orthodox medicine is blind to these facts. Not even one of us physician is ever taught the causes in our medical training. For example, okay, let's just prove it. Like I said, I can teach medical students more in 2 hours than they learned in 8 years. Watch this. Within like 2 minutes, I can teach you more than a medical student learns in 4 years of medical school. What is the cause of obesity? Eating high-fat diets, eating processed food. Okay, what is the cause of hypertension? Eating high-fat foods and high dietary sodium and low potassium and magnesium, okay? What is the cause of diabetes? Dietary fat's the main cause of insulin resistance. What is the cause of atherosclerosis? Atherosclerosis is a blood clot. Anything that makes a blood clot predisposes to atherosclerosis. What predisposes to making the blood clot? High-fat diets, lack of dietary fiber. So you get, fibrinolytic clotting, okay? Being severely dehydrated, okay? Trauma to the blood vessel, okay? Excess sodium, inhibiting nitric oxide, all right? That's pretty easy to do, okay? What's the main cause of autoimmune disease? Leaky gut, increased intestinal permeability. What's the main cause of cancer? The metabolic theory of cancer. Something that injures the mitochondria, most commonly hypoxia, okay? Animal protein activates growth factors to stimulate it to proliferate and grow. Okay, right there, 5 minutes. That was like 2 minutes. And I told you the major causes of the most common diseases. Medical students don't learn that in 4 years of pre-med, 4 years of medical school, 4 years of residency, 3 more years of fellowship, and they still don't know any of that. So you want to tell me it's not a joke? Please. Okay, Dr. Day continues. No one is cured of cancer by these orthodox methods. If a cancer was cured, there would be no need for follow-up with the doctor. No medical agency publishes cancer cure statistics. At best, they publish 5-year survival statistics, which just means that the patient is still breathing 5 years after diagnosis. That's why there is such an emphasis on early diagnosis, because that will make 5-year survival statistics look better. Okay, do you understand what a joke that is? Screening, by the way, is mostly a joke when you talk about screening for cancer by imaging. Okay, and the reason it's mostly a joke is that does it really make any difference in the patient's outcomes? For every cancer that's diagnosed as well, there's tons of patients that have incidental follow-ups. The joke in medicine is, what's the definition of a healthy person? Somebody who hasn't had a body CT yet, meaning a chest, abdomen, and pelvis. Because in the vast majority of patients, there's a lung micronodule from sometime in their childhood, scarring in the lung, a borderline size lymph node to follow up, or there is a sclerotic spot on one of the bones, like in the spine. There's an adrenal gland nodule, a liver lesion too small to characterize on non-contrast CT, so they need to get an MRI of the liver, a lesion too small to characterize in the kidney, try an ultrasound to look for a cyst, then maybe send them for an MRI of the kidneys. But I'm saying there is tons and tons of this. The other joke in radiology is the theme song is Hotel California, because you can check out but you can never leave. There's always some other follow-up, when somebody gets a body CT. So it's a dangerous game to play. It can become very expensive. Okay, but by diagnosing it earlier doesn't necessarily mean you're going to make the patient live longer. It just seems longer because you caught it earlier, so more patients will get that so-called 5-year survival to make themselves look good. But have they really been helped? That's quite questionable. I personally, I've been involved in screening for over 30 years. I would never do it myself. But that's also because I have self-control and discipline and knowledge. The average patient has none of those things. What I mean by that is if you're going to keep smoking cigarettes and eating junk food, you're high risk for all these problems, and go ahead and go to all these screenings, because I know a lot of people I've known, family, friends, relatives, etc. And they're going to tell me, oh, well, thank God that colonoscopy found my polyp. And I'm like, well, why don't you stop eating in a way that causes polyps? But they don't really get that, because the average uneducated person, they think the medical system is bravo, bravissimo. Okay, they've seen all the advertisements for it, and they don't have any sense that they can do anything to help themselves at all. Okay, anyways, that's part one of I Will Give You Your Health Back by Dr. Day.